Is booty pumping and plugging meth safe? Now, whoa. You might be asking, what did I just say? Yeah, I said that right. Today we're going to be discussing methamphetamine and how it is used via rectally. And I'll be sharing a story in regards to this topic about a patient of mine who actually came into the psychiatric setting plugging meth. Yeah, you heard that right. Now, before I go any further, please like and subscribe to the channel. This is your daily dose of mental health, and I hope you enjoy this because it's a topic that I wasn't planning on covering, but this happened a couple days ago in the psychiatric setting, and it was time to do it. So please like and subscribe. Leave a comment if you've ever heard of somebody doing it, or feel free if you've done it. No judgmental talk here. But yeah, leave a comment, like and subscribe. And please hit that bell icon. It alerts me when somebody does subscribe to my channel. And I just really appreciate the feedback and the comments I get. So let's jump right on in to booty pumping via meth use via rectally. So let's first discuss some common questions with booty pumping via rectal meth use. For example, why is meth plugged? Is plugging meth safer? Meth overdose, and what happens when you plug meth? So let's just jump right on into it. First and foremost, here's something I wanted to say. Taking methamphetamine by the way of rectum has been promoted by harm reduction organizations as a less risky option for recreational drug use, which I actually did not know this as an RN. So they're saying meth via rectum is less risky. Still risky, but less risky. But significant risk, including addiction and overdose, still remain at play and at large. So you can still overdose on it regardless if you use it via rectally. So first question, why is meth plugged? Booty pumping, boofing, plugging, butt chugging is another word, are all terms used for rectal ingestion, which is a slang term that is commonly used in the LGBT community when they're using meth. That is one of the common terms used, which is the common term they use is called Tina, which that's the slang term I'm talking about for meth. So in the LGBT community, if you ever hear the word Tina or whatnot, that is a slang term for meth. So yeah, plugging meth has certain perceived advantages over other methods of use. As stated, they say it is the most safe way. So a couple of the methods of use include, so first, crystal meth dissolves freely in water. It's very easy to prepare the solutions. So these that I'm going to be telling you are some of the perceived advantages. Another perceived advantage is the process requires very little equipment except lube, sterile water, a needleless syringe, and a container. Once administered, the crystal meth is rapidly absorbed through the tissues of the rectum, entering the bloodstream and causing a rapid and potent high. So it hits pretty quickly. It doesn't hit as quickly as IV or shooting straight into the vein use, but it's not that quick, but once it does hit, it hits hard. I've never done this, never plan on doing it, I'm just telling you facts about it. By taking meth rectally, you may avoid some of the health risk involved in injection, smoking, and snorting. Namely abscesses or other injection site traumas and respiratory dysfunction. So that's one of the main things. As stated again, smoking, when you use it via rectally, you may avoid some of the health risk. Especially if you're going to be injecting meth, typically if you're using with other people, Hep C is very prevalent in that regard. Another question, is plugging meth safer? Which I kind of already discussed to an extent, but here's some more info. No matter how it's taken, methamphetamine is dangerous and harmful. And that's what I wanted to state. I'm not telling anyone, I don't want anyone to go out and say, I can go do this because it's safe. They're just saying, is it safer this way? It's still, regardless of how it's consumed, it is dangerous and it's harmful, and you can overdose. Each method of ingestion, including plugging, only adds its own particular risk to an already hazardous and compulsive activity. In particular, the big thing I found when reading some of this was plugging has been associated with an elevated risk of HIV or other STI transmission, including Hep C. So once again, I talked about if you're going to be, for example, shooting it up, you still have that chance of Hep C. Using it this route via rectum, you can once again contract Hep C and other STIs. So really as well, keep that in the back of your mind, and it's another aspect you need to look at. Transmission may occur via anal sex or due to equipment sharing, often associated with chemsex encounters. So that's another thing. So you still do have the risk of developing STIs. That's really the main point. And I know I keep reiterating and talking about some of the same things and repeating, but this is what I'm trying to educate you on and trying to drill it in your head, because it's out there and people are doing it many ways. Other risks include persistent diarrhea, torn or damaged rectal tissue, decreased blood circulation, absorption of toxic ingredients cut into meth batches, and lastly, elevated risk of overdose if the drug is more concentrated than normal or prepared improperly. So for this being the most safe method, as stated, you can still overdose. It is still toxic, depending on how much you're using. And next, leading into it, methamphetamine overdose. Meth overdoses put the central nervous system in overdrive, stressing the body to the point where organs and bodily functions break down. Typically, unless great care is taken, rectal administration may increase the risk of overdose as much larger doses of the drug can be taken this way. Some overdose signs and symptoms may include, but are not limited to, breathing difficulty, chest or stomach pain, elevated body temperature, which I have seen in the psych setting, and I will discuss the story in a little bit in regards to rectal meth use. Rapid heart rate, another thing. So an EKG might show some sinus tachycardia or irregular heart rhythms. Paranoia, psychosis is big. Paranoia and psychosis are very big. Sweaty, flushed skin, and seizures. These are some of the most common signs and symptoms that an overdose might be occurring. Another question: what happens to the body when you plug meth? The effects and side effects of meth use are largely unchanged whether the drug is absorbed through the veins, the lungs, or the rectum. The Russian high. The drug is absorbed and enters the bloodstream through the veins and the rectum. Within seconds to minutes, it reaches the brain and triggers a surge of dopamine, which, as I've discussed before, as addicts, dopamine is what is affiliated with stimulants, and a rush of pleasure followed by a high that can last for several hours. During this time period, you may feel invincible, heightened, confident, and secure. Your body temperature, heart rate, and blood pressure will likely increase. No, it will increase. I'll just be real honest with you. It will increase because on stimulants in general that happens. And your appetite will fade, and you probably won't sleep. That's what, once again, can cause some of those psychosis symptoms. The crash now. Once the drug wears off, this high becomes an exhausted and painful low, known as the come down or the crash. Come down and crash are very common terms used. You may feel anxious, fatigued, depressed, and even suicidal. Often strong drug cravings and the desire to make come down symptoms stop will prompt repeated methamphetamine uses in short succession, sometimes for days on end. So once you start coming down and you're not having that dopamine, you'll go into a depression, and that'll cause you to want to reuse and start binging as well. Which binging on meth and taking repeated doses is an incredibly harmful practice that pushes the body and mind past its proper limits typically. During a binge, you may go without, this is huge, you may go without food or water or sleep for long periods, and I'm talking days. I'm talking once you go 2 to 3 days without sleep, once you hit that 5th day, I've seen with patients in particular, it can be tough, very tough. Real quick, it can be very tough. Tweaking, once the drug loses its complete effect, you may be left with a state of complete physical and psychological devastation. You might be malnourished, fatigued, dehydrated. Those are very common. And that's when you can enter, as I've made in another video, many meth users in this stage become psychotic or delusional as they lose touch with reality, a condition known as tweaking. It's not uncommon for you to sleep 1 to 3 days. That's minimum. I've seen people go at least 5 days without it. Sometimes with full recovery lasting more than a week. So if you go, once you stop, it's going to take a week before you even start feeling somewhat normal again. Once again, let's repeat methamphetamine addiction and plugging. Meth is harmful and is highly addictive no matter how it is taken, and plugging is no exception. I want to reiterate it. While harm reduction organizations may recommend plugging as a safer alternative to smoking or injecting, the speed, potency, and bioavailability of meth via rectal administration are still dangerously high. And that's why I did this. It says, is it safer? I guess it's the safest, but it's not safe. So this means that with each use, you prime your body to develop physiological dependence and addiction, just like with any other drug. And real quick, I just want to, if recovery from methamphetamine addiction, and this is of all kinds, you need to realize that you might need to go to a medical detox, an inpatient setting, outpatient care as well. Those are the 3 because it's very hard to get off this. Once again, even short-term use of crystal meth can lead to dependency and addiction problems, as well as severe, potentially dangerous withdrawal symptoms if you abruptly stop. And lastly, I just want to cover this. If you know somebody or yourself need help getting off of meth, there are resources in every state to get that help, with or without insurance. So before I go any further, real quick, I just want to end this by saying, this aspect of it by saying, please like and subscribe to the channel. Please hit that bell icon, and let's jump right on into just a quick story and why I even decided to make this topic and video of rectal meth use. All right, so real quick story I wanted to talk about in regards to meth and rectal use. So this happened a couple days ago. We had a patient who was a walk-in patient wanting to get help for meth use. She decided to, and once she was about ready to hit the inpatient floor, she was like, oh crap, I don't want to do this. I don't want to do this. They're up front in intake. They're going to start checking her belongings. And she just goes, oh, let me go use the bathroom real quick. Okay, they let her go do it. And she comes out and I'm going to go and tell you now, she had done this before. She took a tampon and put a piece of meth, probably the size of a quarter piece of ice, what it's called, ice, put it in her butt, and went through the intake process. And within the intake process didn't take super long. There weren't a lot of people. Within 20 minutes, she was high out of her mind. She was admitted to the unit, and they're like, hey, look, I was like, has she been acting like this up in the intake? Like, she's acting like she's high right now. They're like, no, when she came in, she was here, she signed her paperwork, she wanted to get help. But what ended up happening was, when she went to the bathroom, she took a tampon, she wrapped up that meth, stuck it up her butt, got through the intake process, walked to the unit, which they need to have changes in protocol where I work about. They should be searched right when they walk in regardless. She made it to the unit. I start doing my assessment because it was my turn to do this admission. I start assessing her, and I notice her pupils were very, very dilated in light. And that's one key indicator that they are very high. And in particular on meth, I knew she had a history of meth due to her paperwork and her admission status. And I was like, when's the last time you used meth? And she started kind of looking at me like, it's been a while. And I was like, be honest with me. I'm not judgmental about this. I know you have a history of meth use. And she goes, okay, I'm going to be honest. I just took a tampon and put this quarter-sized piece of ice up my butthole. And I look at her and I'm like, are you serious? I'm like, and then my next question is, have you done this before? Because I'm thinking, you put that up there, that quarter size, what's the toxicity limit? How much has she been using? And she was somebody who did inject meth, but she was saying, I'm not feeling right, la-di-la-di-la. And she was like, then she asked me the next question, literally in this voice. First, she started acting, before she asked me this question, she started purring and acting like a cat, going, meow, meow, meow. And that's when I knew, first off, she's out of her mind on meth. But I was also thinking, okay, do we need to send her back out to the ER? Because I don't want her to have a heart attack or something on me. Her heart rate was very elevated. I checked her vitals. It was all high. But I know with meth use, okay, it affects your central nervous system. It's a stimulant. The next question she asked when she starts acting like a cat is, can you pull this piece of meth out of my cat booty hole? And purring, saying, it won't hurt, just go up there and get it. So I pull another nurse in the room to sum up the story. I told her what's going on. And when I told another nurse, she curls up in a ball, drops her pants, and goes, I'm going to pull it out right now. And instead of that, she literally started pushing, and she defecated herself, and shit you not, literally, she pooped out that condom, and it had been like disintegrated, about a penny's worth of meth use. However, at this point, okay, just because she pooped it out, she still had enough in her system to be messed up, to be pretty up there. So when we looked at it, and it was horrifying having to do, but when we looked at it, there was about a penny size, and I go, how much do you think is disintegrated off this? And she goes, oh, it was about a quarter size. So immediately I let my manager know what's going on, and we sent her out to the hospital to go get evaluated. She came back within 24 hours. They had to give her some Ativan IM to calm her down, because she was once again whacked out of her mind. And in the psych setting, we don't start IVs. But the whole point of this story is, that is why I made this video, is because this is something that's happened recently, and I didn't even really know that meth was used rectally. Thank you for watching this video, everyone. This is your daily dose of mental health. I'm sorry I haven't done a video in 2 weeks. Last week I was, and I can't say this, but I was sick, but just my energy was down a little bit, and I've been busy, but I'm going to continue putting videos out as much as I can. If I go a week or so without one, don't worry, I'm going to be putting more out. But I appreciate everyone. I hit that 200 subscriber barrier that I've been looking at. That's really cool, and I appreciate every comment that you guys put out. It really, it helps me in my own mental health recovery journey, and I'm happy to see that that my content is at least helping others. But let's just keep on pushing this out. Like, subscribe, tell your friends, family about the channel. This is a non-judgmental channel. If there's anyone who has an issue or using meth or any drug, just know there is a way they can beat it. They can become clean. I had my own problem with drugs in my past, and now I work in the psych setting. So I do this because I want to show everyone out there that just because you are or were a drug addict or in a serious active addiction, you can beat it and you can help others. 5 or 6 years ago, I would have never done this. But I'm going to continue this because I just want it. If it just helps one person, that's what matters in the end. Once again, please like and subscribe and hit that bell icon. There will be more content coming out. I'll have another video probably coming out within the week as well. So just check it out. You'll be able to check that out. I'm going to be talking about more of the psychiatric drugs, which I'm going to be covering Haldol in my next video. So I'm going between a lot of topics, but it's all mental health related, and then I'll be doing a motivational mental health video tied in with the story. Love you all. Have a great day. Let's have a great week. Leave a comment. I love you all.